What is it? All right, sir. So you'll see this big light here, okay? Just keep looking right at that light. Here's some numbing with it. Down or the left. Look down. And this does feel kind of spicy, stingy, like an eye drop that burns. Bear with me. Only have to give you this one time. Very good. Keep looking down at those notes. Alright, so yes, so I'm in the front part of the eye and touching your cataract. We have to take it out in a very precise way. Loosening off the edges and then break it up into small pieces. And in a second here, you'll hear some beeps and buzzes behind you. That's our machine. It uses essentially ultrasound energy to break up the cataract. Alright, so you hear that beep. Feel some water on the eye, and you'll start to see some more movement. Try to keep looking at those two lights.
Allocate to a few things. Okay to receive DMK, 10 to 20. Once I have a CC60WF 20.5, expiration 3/25/28.
Quadrant removal.
Core's doing okay?
Yeah.
Very good. So the largest layer of the cataract is out now. We'll have to take out the swollen now. Look at the light.
CC60WF 20.5.
Polish. This way.
You're almost done. All the cataract is out. Your new implant is in. Just doing your final cleanup. Good. Look at those lights. Look down at those lights. Look down. Now look at the light. All right, you are all set. Good job. You feeling okay?
Yeah,
You did so well.
so you did so well.